The onus is mostly on the women to take contraceptives, you know, and I mean the daily ones. The boys can say, look, I'm expected to bring the condom, but that's all. The girls are expected to bring everything else and also do the pill every day part of it. But what are the biggest barriers that young people still face when trying to access contraception?
There are a number of challenges that came up from the study. One of those challenges would be, of course, well, they differ whether you're in an urban or rural area. But one of the challenges is that adolescents are obviously at school until a certain time. And so if they require the services, that means that they have to go to the clinic after school. And as much as some of the facilities would allocate a time that is there just to support, to provide services to adolescents in the afternoons, they cannot, reject other people who need healthcare when they come in the afternoon. So there's that aspect. There's the shame about using or being sexually active or using contraception in certain communities. There are misconceptions about some of the advantages and disadvantages of using certain contraceptive methods. There are just various social norms, cultural, religious, that also impede on how and when young people can use these types of services.
Yeah, sure. Yeah, you've named them all basically. You know, it's cultural, it's religious, it's social, it's also the services that you receive at hospitals, especially sometimes in certain demographics. But thank you so much for your time. I actually thought about it, Doc. Sometimes the reason why the onus is on the girl or the woman to do the contraceptives is because the one who will show that the baby is on the way is us. Right?
Right.
Yeah, so we have to also take a bit more responsibility if you don't want that bump to keep growing, especially when you're still too young or not ready.